Hi, everyone. So, Derek and Roberto from Ottawa. We're at the Ottawa table today. We come from MAX. Who is MAX? So we're the former Ottawa Gay Men's Wellness Initiative, which is a community-based organization by, for, and with gay, bisexual, two-spirit, queer, and other guys who are into guys, whether cis or trans. We are very proud to be the first standalone LGBTQ men's health organization in Ontario, and our approach is one of holistic health, so sexual, mental, social, physical, and spiritual health and wellness. Today we're going to focus, because most of the work we've done over the past 2 years is around mental health. So what does MAX do? We help guys into guys maximize their health. We get them connected to competent mental health services, which is what Derek and I will talk about today. But we also have a very strong commitment to connect guys to through community activities. So whether it is community activities that we'll create with them for them, or that they'll bring their own ideas and we'll support them to make them happen, or just making sure that people are aware of all the community activities and opportunities in the city.
All right, so we're going to be speaking about one service and then the partnership table that we host. So I'm going to be speaking about mental health navigation. So mental health navigation seeks to connect guys to competent mental health services. And I'll get into how we set it up and what that looks like in a minute. This is the process. So when someone is looking to see a counselor, a psychotherapist, a social worker, or a psychologist, or any sort of like community groups or support groups, they can make an appointment with us through our website, through online apps that we're on, so like Grindr, Scruff, Hornet, or they can call in, and we do an intake. So it usually takes about half an hour to an hour. We figure out, what their needs are, how much money they have to spend, if they have insurance, what part of the city they're in, and sometimes we, like, if they have all of these things going for them, especially insurance, like what sort of like personality they're looking for in a counselor. So, and if they have a gender preference, if they have, sometimes. This one's really hard. We'll talk about this in the challenges, but like counselors of color. So sometimes people are coming in who are experiencing racism and would prefer to be with someone who's a counselor of color who would get these things based on personal experience. The second thing is the referral. So usually within the next couple days, I talk about this in the intake with them a little bit, but I send them a list of referrals that might be that might work for them. So I list the pros and cons. I try to get something that's in the same area that they're in, so that people aren't having to travel to like from one suburb to the other, or if they're downtown, traveling like way out of downtown to find something. When we're talking about accessible services, so services that are pay what you can, sometimes that's unavoidable if we're looking at wait lists and stuff. And then we follow up. So we follow up in 1 to 2 weeks just to make sure there was a connection made to the service. And then we follow up again in 3 months just to make sure that everything went well and that it was a good fit. And if not, we offered to start from the beginning and like set them up with someone else. And sometimes we just like don't hear back from people. So that's another reality, which I hope just means that everything went well for them. So how did we set this up? So there were a couple things I wanted to say that aren't on here. What we wanted to do was kind of like set up a network of counselors that we felt comfortable referring out to, and that every referral that we made was a warm handoff. So we started with a group of people that we kind of like trusted and knew and had worked with in the past, either through like jobs that we had done in the past, or either through people that we had worked with in the past in other positions, or people that were like close to the Gay Men's Wellness Initiative, which was what MAX was before as a community group. So from there it was either people that recommended counselors that they had worked with, counselors that we were referred to by people in our network already, and I would set up appointments with them. So when I first started working with Max, I would set up appointments with them for about an hour, and I would kind of go through a checklist. So looking at like what people's connection to the community was and how they're connected to the community. So most people are either like part of the LGBTQ plus spectrum or have some sort of connection, have worked with folks in the past, queer folks in the past. Sorry, I just got like distracted by the like 5 minutes left. Yeah, and then also things around like accessibility. So making sure that like if we're referring someone that is using a mobility device, that they can actually like get into the office, and like practical things like that. So like bus stops, etc. Then, yeah, consultations with community and partners. Yeah, so we just started referring out to people and getting feedback on. So we started with a small group and we would get feedback from like people that we would refer out. So sometimes it'd be like, okay, like this person was referred for this topic. How did it go? Okay, maybe like they're good on these topics, but maybe not so much on this. So it's finding out like what people are competent in. Because just because they're queer and they work with queer people doesn't necessarily mean that they're strong in like all of these areas. So that's good for us to know. And then yeah, Roberto's going to speak about the partnership table, which involves most of the people that are in this network, but working from a more structural and systems level.
So something that from the beginning we put in place was a mental health partnership roundtable. We realized from the needs assessment before setting the service, from the Ottawa Hospital survey and other research that there were some gaps in services. So we wanted to make sure that we weren't only offering the navigation service, but that we were already also starting to look at the reality on a more structural level. So just like Travis was mentioning in the beginning, this roundtable idea, that's what we set up as well. So we've been having the Ottawa roundtable for a year and a half. We hold meetings quarterly. And who is included? We have some private practitioners. We have agencies that offer mental health services or that have a mental health mandate, like Ottawa Public Health, and other agencies that work with guys who are into guys. So we have over 15 agencies that sit at the table. They don't always all come to all the meetings, but that those meetings and those partnerships have helped us also address some of the gaps that we have identified. For example, we had identified, we were told that there were difficulty looking for services around intimate partner violence and sexual violence for guys into guys. So we are not intending on putting and starting everything from zero in-house at MAX, but like there's the counseling family services of Ottawa who have developed an expertise in the subject, but not for guys into guys. So we, thanks to that partnership roundtable and work that we started, we're going to start in the next fiscal together bringing their experts in that area with our expertise, reaching out to the community and together co-facilitating and offering support groups around intimate partner violence for guys into guys. So that's an example of how these partnerships are important to address those gaps and not starting from zero and taking what everyone's expert on. So that's one of the ways that we're addressing systemically to respond to those issues.
All right, I think we have like a minute left, so I'm gonna go through these quickly. So some of the things that we're working on going into the next fiscal is motivational interviewing and short-term peer counseling. Support groups, so we have 4 support groups that were developed by ACT that we're going to be implementing, and if you were at the group with Robert and Matt earlier, they were talking about our Community Maximizers program, which one of our first pilots from that was an ACB queer and trans guys into guys support/social group. We'll be doing short-term peer coaching, and other things that we're talking about are walk-in counseling. So we're working on another center for that, working with another center for that, and online coaching, which we're still trying to figure out. Some of the challenges that we've faced are like things that have been mentioned like throughout the day. So obviously developing partnerships takes time. Long wait lists for free or affordable services. So we've seen like sometimes the shortest is like 6 months. They can go up to like 2 or 3 years depending on what you're looking for, and especially depending on the severity of the case. Lack of diverse profiles of healthcare professionals. So like I was saying, counselors who are people of color, finding referrals for our trans clients has been a bit of an issue, although we've kind of sorted that out a bit. Yeah, so we're working between, as Paul was saying, Gatineau and Ottawa. So sometimes we're a little bit unfamiliar as to like how things work in Gatineau and like finding people and connecting them. But we try to just reach out to other social services and service providers there that can kind of do navigation on the Gatineau side. And that's us. Oh, the other thing I was going to say is we left. I left some cards of ours on the table outside that has some information about the navigation service. It's really quick. It's just like 1, 2, 3 how it works and our contact information on the back. But just to give you like an example of the things that we distribute to promote it. Thank you.